Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. I'm SAFIEN, PhD candidate from UKM, and I will represent our team to present a study titled Mental Health Status of Older Adults in Malaysia During COVID-19 Pandemic, Its Relationship with Resilience. For introduction, the detrimental impact of COVID-19 pandemic on general population globally has been thoroughly discussed in other previous studies. Specifically, for older adults, COVID pandemic resulted in the decrease of their social interaction, difficulties accessing services, sleep disturbance, reduction of physical activity, as well as increase of depression mood. However, researchers have shown that older adults may possess high resilience trait despite of socio-economic backgrounds, personal experiences, and declining of their health, which may give them more favorable impact despite of this unfortunate and distressing period. This study thus aims to determine the mental health status of Malaysian older adults during COVID-19 pandemic, as well as to see mental health relationship with self-perceived resilience and other socio-economic factors. This cross-sectional study using purposive sampling method was conducted among 167 community dwelling older adults in age 60 years old and above in KL, Selangor, and Rembau. Back depression scale, PDI, and 10-item corner Davidson resilience scale were used to measure level of depression and resilience. Socioeconomic factors being assessed were gender, race, history of head trauma, work status, household income, smoking, alcohol consumption, living arrangement, as well as multimorbidity and polypharmacy issues. As for the results, majority of the participants were men, 50 were men, Malay, live with family, currently not working, from B40 household, not a smoker, not an alcoholic drinker, and have no history of head trauma. They don't take more than, majority of them don't take more than 4 medicine daily and are having multimorbidity. Majority of the participants, which is 96% of the participants, have good mental health status. However, those with multimorbidity experience a significant higher level of depression than those who did not have multimorbidity. Depression and resilience show significant but weak correlation. Multiple linear regression analysis indicates that multimorbidity will increase the likelihood of experiencing depression by 1.8 times in older adults. Contrary to to the younger population, whom their resilience contributed much from social support, older adults possess their resilience through emotional regulation and problem solving skills. This thus may aid in the maintaining good mental health status of Malaysian older adults during pandemic. This study also showed that older adults with multimorbidity has higher chances to be depressed than their counterpart with no multimorbidity. This is because multimorbidity poses higher somatic burden to older adults and interact with pathophysiology development of depression. For the conclusion, despite of the multiple challenges they faced during the pandemic, Malaysian older adults had been able to maintain good mental health, but those with multimorbidity seems to be at risk of depression, and depression related to a lower resilience. Hence, there is a need to identify those at risk for poor mental health and depression early for an appropriate intervention strategies. That's all from me. Thank you.